Dr. Herrera. We're here today at Bedford Dental Care in Bedford Hills, New York, and we have a patient today. We're doing 2 arches of 3 on 6. We have Dr. Micah Weissenberg here out from Utah.
Coming out here and seeing how this is materialized into this practice you have, all the technology that we have back in Utah and any of the top end offices, and you're just doing some of the most phenomenal cases and phenomenal work. Today's case is medically complex, dentally complex.
Mm-hmm. It's all about making sure that the patient has a good result in the end, because if they're not happy, I'm not happy. So that's why all the education, that's why all the technology, just to make everything super predictable and really make sure that these outcomes are the best that they could be. All right, so let's jump into the surgery.
Let's get it. Straight from Baltimore.
Baltimore. Oh, God, what a difference, huh?
Yeah, that's Dr. Weisberg, the one I was telling you about.
Yeah. Growing up, I told you, I had a grin, and I missed that, It all started with an accident, my front tooth. And then from there, I went like a skateboard down a hill.
Yeah.
It's not an easy thing you're doing,
Right.
I mean, but compared to what I've seen on other things with the X's, what is that, 4X or whatever?
Oh, yeah, right. Oh, nice.
It looks like a grenade went off in somebody's mouth with that thing.
Oh, right. I know, this is...
That is like, oh my God, it's like, this is scary.
Right.
So
oh, you were
like,
gung-ho. You were like, this is what I want. I've done the research.
Push me out of the plane, just parachute, I'm ready to go.
Yeah. So you knew what you wanted.
Did a lot of reading and stuff.
Yeah.
I always do that.
There
was a fireman that came from Staten Island. He flew to Utah. I seen his video.
Yep.
That's the first video I've seen of it. And then I said, he's got the nice smile and everything, and he's very happy. And I think I trust him.
I think that's really great. I mean, all the videos, the Facebook group.
Yeah.
You get to see people's experiences.
YouTube, that's all I do.
Yeah.
I just wanted something that's, reassuring and 100%. And I think this was the best route to go. And the results will speak for themselves, and I think I'll be very happy.
So any other questions?
None.
Yeah, we have our plan. Yeah, let's go back there, get you comfortable, and get this going.
Yeah.
Don't worry, we're not going to leave you alone.
No, that's okay. That's all right. Oh my God, there's more people. What is this?
We have a team for you.
Can you open your mouth a little big for me? Stick your tongue out. Good. All right. Close. Is there anything loose? Any loose teeth?
No.
Crowns, piercings? No.
This looks like it's going to be fun.
It will be.
When you wake up, you're going to have a new set of teeth. All right?
Hopefully.
Oh, yeah. It's going to look beautiful. All right, so we're in the middle of surgery. We have our seating guides placed. We've done some extractions and everything done atraumatically. Everything is looking really good. For these surgeries, we basically do them twice. The first time we do it on the computer, everything's planned digitally. And then the second time is when we're actually doing it on the patient in person. And everything's going according to plan.
So, can we place implants? Yes. We're all well trained, but we utilize technology to get the most precise results. So while we have our implants planned, doing this in the mouth and recreating it perfectly freehand, when you have fractions of a millimeter for margin of error, it's very difficult. So we utilize technology to actually create drilling guides based off of our plan to allow us to recreate what our plan is with precise accuracy and precision.
So this is a surgical guide, and this is what guides our implant osteotomies, basically the holes that the implants are going to go into. So we've done all the planning ahead of time, and these little sleeves of different colors, they guide our implants into the exact spot that we've planned them to be in. So we do this guided so that we have a beautiful prosthetic, and it's really predictable, the outcome, and the patient is really happy with it because that's the aesthetics that they wanted. So things are going really well. We finish our scans on the bottom, And now we're moving on to getting the implants in on the top. We're just in the process of taking out the teeth that will allow our guide to fully seat. And then we're gonna get going on those osteotomies, the holes for the implants. And yeah, once those implants are in, we'll attach our scan bodies and do the same thing we did on the bottom. Just get the scans, send it off to the lab. The lab designs it while we're doing surgery. So it's really a great workflow.
So right now we're switching gears from the surgical mode to the aesthetic prosthetic mode, okay? When we're doing these types of reconstructions, we always start with the end in mind. This is where we started, and go ahead and show us what our wax up or our planned final result will be. And that's this. Based off of where these teeth are, that's how we determine our implant positions. Go ahead and show those. And as you can see, all of the implants perfectly go underneath the teeth, so they're not coming in between the teeth, which gives an unaesthetic look. Now, we're bringing in the existing tissue that we have now, and we're going to be contouring that. So we have an aesthetic, functional, and maintainable prosthetic that will look flawless.
So next we're going to be printing our temps, 3D printed temps, and we're going to be sculpting the tissue around those temps so that everything looks as natural as possible.
How long will it smell?
So that's how we get all the sutures.
That is so amazing.
With
He's gonna be so
yeah,
He's so happy.
yeah.
He really is. Thank you.
Dr. Weissenberg does tons and tons and tons of these cases, and he said that that was the best one that he's seen in a long time.
Yeah, this is in my time.
I gotta get a picture of you guys together. This is dream team.
The team. How's it been?
As far as my experience, I am overwhelmed that there's no pain. I'm really like,
And right now, how many days out are we? Today is Tuesday. We did it Saturday, so we're like Sunday, Monday, 3 days.
yeah. I mean, right here, I really didn't take any pain medicine. I took Tylenols 2 times, and that was it. I mean, other than that, the pain, the trauma, because you took your time. Trauma, there was no trauma, and that would make the pain, I guess. But it's definitely uplifting and changes you. I think, she says I got a different attitude now.
Oh, Kathy sent me a beautiful text message last night. Yeah. What was unexpected about the experience? Because you watched so many videos.
What was unexpected was really nothing. I'm up to the moon. I swear.
You felt that those videos prepared you to that. It was,
your team. You have a team that works well, hand in hand. They're all on the same page.
right.
And it was good. Right down to the anesthesia. He did the right thing.
Dr. Rivera's
That
a lot of visits in the beginning. It's
Yeah.
the consult, the records visit, the surgery, and then the post-op. So that's 4 visits right there.
Mhm.
And this is our 4th visit. So we have 3 more visits. And yeah, I think that you'll be all buttoned up by New Year's for sure. So we have Bill with us today for a follow-up visit, and Bill's going to tell us a little bit about how his post-surgery. Today's a month. Yeah, today's a month exactly. How has your diet changed? Has it been, mostly like
I lost some weight. It's like, I'll have oatmeal, cold cereal, let it wilt a lot, in the milk. I tried to eat some chicken and that didn't go up.
I tell patients to try to chew your food on your plate. So cut it up into as small pieces as you can. When you rub your tongue across your teeth, does it feel like
That's a little rough because I guess the plastic,
okay?
they're not enamel and remove, like real teeth. But
I mean, does it feel bulky to you?
oh yeah, and behind,
Yeah.
you built it up a little bit.
Yeah. So the first set are thick. The final zirconias. That's when we can make them slim.
Right.
So that's going to be something that you're going to notice also as we move on through the process.
I like the fact that the gums they're rub tight with the teeth and everything.
Right.
It doesn't look like All-on-4 or anything like that with
Right.
the plastic gums and which I would not accept. You know what I'm saying?
Right. Yeah. No, it's your natural gum.
Yeah, I'm looking forward to the next set and then the finals. Then
then, then I'll be really
Yeah.